I would first remind people that providing the ability for a woman to obtain an abortion is the law of the land. It's not politics, it's the law. It's legally allowed and required to provide that service. New York State Department of Health requires us in this community to provide the service. In addition, there are many who believe that the services of providing terminations is also a provision of health care. We may not always agree with that, but it is a provision of health care. When the Berger Commission said, you will provide full reproductive services or we will close a hospital, those of us who were involved in the hospitals knew that based upon that recommendation, that caveat, that Benedictine would be the hospital to be closed because Benedictine would not offer full reproductive services. So we came together as a community, we brought together the two hospitals, the boards of the two hospitals, and we found a compromise, which was the Foxhall Ambulatory Surgical Center. Foxhall is more than an abortion clinic. It provides full reproductive services. That was a linchpin of the alliance, and the State Department of Health said, you will make sure that Foxhall is operational and you will have a provisional certificate of operation. And as long as that's operational and we approve of what you're doing, we'll allow the alliance to go forward. But we're going to watch and make sure that the community continues to receive those services. So it was felt early on that it was important for there to be at least some board members who were on Health Alliance as well as on the Foxhall board, because without Foxhall, the alliance falls apart. So we need to do that from the standpoint of the Department of Health and how those services are provided.
The next speaker is Margie Griffin.